The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. Welcome to the Act on What's Important, Organizing for Policy Change webinar. Today's webinar is part of our Take Action series of webinars. My name is Karen Odegaard, and I am a community coach with the County Health Roadmaps Project. My colleague, Kate Kunkel, is also here to help answer your questions along the way. We are pleased to be joined by Rob English, who co-leads the regional staff of Metro IAS and works with Baltimoreans United in leadership development, or shortened version, BUILD. Rob will talk with us today about how the community organized around a single focus to accomplish a huge win for Baltimore schools. He'll share 3 key lessons that you can use in your efforts to change policy, both large and small, in your community. We want to take a moment to acknowledge our many partners, including the Robert Wood Johnson Foundation, our colleagues here at the University of Wisconsin Population Health Institute, and the various other partners who help us compile the rankings data and get the message out about rankings and roadmaps. We also want to take just a moment to get you oriented to the technology that we're using today. The GoToWebinar attendee interface is made up of 2 parts. On the left, you can see the viewer window. This is where you'll see my screen throughout the presentation. And on the right, you can see the control panel, which is where you can interact with us. So we've got a number of folks on today's webinar, and so we'll be taking questions via the control panel. You can feel free to enter your questions in the control panel at any time, and we'll answer them toward the end of the webinar. Well, we will also be chatting out additional links and information throughout the webinar, and you'll see these chats in the control panel as well.
So as Karen said, we're going to give you some opportunity to interact with us, and this is going to be your first. When you registered for this webinar, we asked you to let us know what's going well with and what's challenging about acting on what's important. So we're going to put up 2 polls with some key themes that we heard from some of you and see what resonates with you. So we'll start with successes, and you can select more than one. But some of the key themes that we heard from you guys are that you had success around building partnerships and engaging the community, that you know what you want to do, that you've successfully implemented some programs, that you've had a policy victory, and then we have the option of some other great things that may not be listed here, but you've got some good things going on.
So we'll give you just a moment. We call these our rapid response polls. We'll give you just a moment to complete that, and then we'll take a look at our results. And we'll just go a moment more. Okay. Thank you for your responses. We will take a look at that now. So a lot of successes around building partnerships and engaging the community, which is fantastic, and it's so critical for being able to act on these on what's important in your community for doing policy change and implementing programs.
Yeah. And also some good success around knowing what you want to do, and that's an important first step, as we'll talk about some today, is really understanding what your end goal is and knowing where you want to go.
And some of you have had policy victories and are implementing programs. So please, as we're talking today, feel free to use that question and chat feature on GoToWebinar to share some of your insights if you have some about what's really worked well in your community. And I think this is just another opportunity for us to take a moment to celebrate and to recognize that we've had some successes in this area and congratulate ourselves on those.
Yep, and that's great to hear. We also know, though, that this can be a challenging area, as many of you who are on the webinar today probably recognize. And so we want to hear what resonates with you regarding challenges. So some options here that we heard from you: that the political context is difficult to navigate, that engaging and organizing people to work on specific issues is a challenge, getting people to work across silos, and then if none of those resonate with you, but you've got another challenge, just let us know that there's some other hard things you're dealing with. So take, again, another minute to answer. You can answer more than one, and then we'll take a look at those.
Okay, and we'll just take a moment more. I'm going to say that we have more people responding to this than we did to the successes, so which isn't all that surprising. It can be sometimes easier to think about the challenges that we have. So this is interesting. I love that this is split almost exactly evenly across the 4 options.
Yep. And I don't think that's surprising at all. I mean, these are all really difficult and challenging things to do, and we know that these are barriers to people really moving forward and getting things done in their community.
Yep, absolutely.
And hopefully today's discussion will help you think about some of these things and how to overcome them.
Mm-hmm. Thank you for participating with us in that. It helps us get a sense, too, of where you're at.
And again, please continue to interact with us via the chat feature and the question log, and we'll try to respond and
incorporate your comments as we can.
Yep. So here is a quick outline of today's webinar. We are going to start with a brief overview of county health rankings and roadmaps just to get you acquainted with the website. Then we'll talk with Rob about Bill's work in Baltimore, and finally have some time for your questions before we wrap up. And again, if you have a question or comment, please be sure to write us in the question box. We hope that by the end of the webinar that you will know where to find tools to help you act on what's important in the roadmaps, the Health Action Center, that you'll understand how to engage the community members, how engaging community members led to a big win for schools in Baltimore, and then understand the role community engagement can play in your health improvement efforts. So before we get started in our discussion of the roadmaps, let's take another quick moment to see where you're at in this action stage of act on what's important.
So if you joined us before the top of the hour, you may have seen this question, these options on your screen as we were preparing for today's webinar. And this, again, just helps us understand where we're at with doing this work, actually implementing and acting on policies and programs in our communities.
And we certainly know that communities are really at very different stages in this work, and so wherever you're at is fine. We just sort of want to get a sense of, of where you are today.
And let you all also see that wherever you are, you're not alone.
Yep.
in this work. So we'll take just a moment more, and thank you for sharing. Here are our results.
All right, so about half of you that answered are in the stage of developing an action plan for policy change, which is great. I think that hopefully then today's discussion will really help you in taking those next steps to implementing.
It does look like we have some folks who are, you're still figuring out where to start, how to get started. I'm going to encourage you to take a look at the Act on What's Important guide that we're going to show you in just a moment as you think about your work and think about how that tools there and the guidance there might be helpful to you.
And again, a couple people who have already accomplished some policy change and hopefully are maybe moving on to another goal or another policy that they're hoping to implement. So, but great job on your current success.
Yeah, and definitely, again, feel free to chime in using that question and chat log to let us know what your insights are as we talk through today's webinar.
Okay, so now we're going to do a quick overview of the County Health Rankings and Roadmap. So most of you are familiar with County Health Rankings, which ranks the health of nearly every county in the nation. And the rankings illustrate what we know when it comes to making people sick or healthy. And this model really underpins the county health rankings. So starting from the bottom, we believe that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. Many health factors shape our community's health outcomes, and we specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. And we measure two types of health outcomes to show how healthy each county is. We look at how long people live and how healthy people feel. When communities assess their needs and resources, they often start at the top of this model, looking at how long people live and how healthy people feel, and then dig deeper to understand the health factors that influence those health outcomes. Understanding your community's strengths and challenges will help you take action through policies and programs that build on your strengths and address your challenges to improve health. And this is where County Health Roadmaps comes in. Roadmaps show us what we can do to create a culture of health in our communities. Today we're going to focus on the action, specifically how do we engage people in our communities to work together to change policies so that everyone has better health outcomes. This is the County Health Rankings homepage. From here you can get to your county's ranking and data, and you can click on the County Health Roadmap section of the website. From here you can find a variety of tools and guidance to assist you in the Action Center, as well as What Works for Health, which is a database of nearly 200 evidence-informed policies and programs to choose from. Community coaches are also available to consult with you about how to best move action forward in your community. In the Action Center, you can click on any step in the Take Action cycle to find guidance and tools for the various activities that make up that step. Our Act on What's Important breaks this down into 9 key activities so that you can find guidance and suggested tools for exactly where you are in your process. And we're going to send you a link to the Act on What's Important guide so you can have that and go directly to that page.
So we're going to turn now to our guest, Rob English. Rob co-leads the regional staff of Metro IAS, a network of citizens' power organizations based primarily in religious congregations and schools across the Midwest and Eastern United States. In healthcare, affordable housing, livable wages, education, and other areas, Metro IAS affiliates have won local and statewide victories that have been widely replicated elsewhere. Metro IAS is affiliated with the Industrial Areas Foundation, the first and largest citizens organizing network in the country. We're going to share a link so that you can learn more about Metro IAS if that's of interest. Since 1995, Rob has organized with IAS in New Jersey, New York, Maryland, and Ohio. He has spent the majority of his time in Maryland with Baltimoreans United in Leadership Development, or BUILD. BUILD is one of 30 Roadmaps to Health community grantees currently working to create positive policy or systems changes that address the social and economic factors that impact the health of people in their communities. BUILD has a long list of accomplishments, including the one that Rob's going to talk with us about today. Through the Baltimore Education Coalition, BUILD helped unite Baltimore, it's easy for me to say, to pass $1 billion in state and city financing to build and renovate 45 schools. This is the single largest investment in Baltimore's neighborhoods, and it is a defining moment in education reform. Welcome, Rob. Thank you so much for joining us. And start us out by telling us a little bit about Baltimore.
Sure. It's great to be here with everyone. Really appreciate the County Roadmaps to Health program and the Robert Woods Johnson, and particularly with Kate and Karen's help. So it's great to be here. Many of you might know Baltimore, but the backdrop of Baltimore, like many Rust Belt cities, is it's a tale of two cities. There's a downtown and there's an uptown. Downtown, as you see on your PowerPoint, is the Inner Harbor. It's known as the crown jewel of our city, and many of you might have even visited the Inner Harbor. But that's a direct contrast to Uptown, which is Baltimore's neighborhoods. And many of you might not have visited Baltimore's neighborhoods, but if you've ever watched The Wire, you've seen them on TV. It's 40,000 vacant properties throughout our city. It's really one of the ground zero cities for blight. In fact, some people have called it the national poster child for blight. The Build organization with several mayors have made progress on reducing blight. We've built over 1,000 affordable homes in the neighborhoods. But what's still prevalent is it's a tale of two cities, uptown and downtown. And what this victory did for us in Baltimore with lots of allies was the $1 billion victory was the single largest investment in Baltimore's neighborhoods. It will create 8,000 jobs, and as you all said, build and renovate about 45 schools. But for our members and for people who've lived and grown up their whole life in Baltimore, literally this is one of the first steps of imagining that Baltimore was no longer about two Baltimores, but one Baltimore. We could rebuild our neighborhoods and have their crown jewel. In fact, parents in this campaign talked about that renovating our schools, we want our schools to be the crown jewel to our neighborhoods as the Inner Harbor is to downtown. We got a long way to go and a lot of organizing to do, but we're on the right track. So to recap, through the Baltimore Education Coalition, which is a partnership of 26 school-based organizations, Build won the $1 billion in city and state funding to build and renovate our schools, 8,000 jobs. As importantly, it's about revitalizing our communities so that people begin to are attracted to move back into our neighborhoods. One of the biggest barriers to our city's growth is attracting residents back. And the first thing that people talk about, one of the first things they talk about, is the lack of access to schools. I can't reiterate enough that once we've accomplished this, it will be the single largest investment in Baltimore's neighborhoods.
Rob, this is such a huge win. It's such a big deal. Not even just for Baltimore. I think other communities can look at this and say, wow, this is huge, and how do we do this? And can you just talk a little bit about how you got started?
Sure. Like many of you, look, we all knew about the deplorable conditions of our schools. I can tell you story after story, and maybe as I tell this story, many of you can imagine your own policy area that you're working on and what really makes you angry. But in Baltimore, we have children that literally don't go to the bathroom the whole day because the conditions of the bathrooms, if you see on the slide, they're scared to go to the bathroom. And then they get blamed for not wanting to learn. It's not that they don't want to learn, it's that they're having a hard time concentrating. Ceiling tiles falling in libraries and classrooms, flooding. Literally in many of our schools, because the boilers are so broken, you can walk into a school hallway. Imagine this, y'all. You walk into a school hallway, and on the left side of the hallway, there are children literally in the dead of the dead of winter, in mittens and gloves, shivering. And then directly across on the other row of classrooms, they're stripped down to their T-shirts, sweating because the heat is so malfunctioned. So given those conditions, we knew the problem. The problem was a systematic disinvestment in our school facilities that totaled a $2.4 billion need. So the question really became, what's going to be done about it? What are we going to do? And many of you might be able to relate to this. We knew the problem, but there was a lot of talk. Everyone knew it, but there were no large-scale investments, no plan. And from administration to administration on the state and city level, people passed the buck to the next generation of kids. In public health, we often have a solid understanding of the issues. just like we did, and the evidence-informed strategies can then address those issues. And right now, if I asked you, what's that one policy or that one condition that keeps you up at night? Just take a moment and answer that for yourself. Really think about it. You all would name it right away. The question, though, for all of us is how can we act on that? How can we act on those things that keep us up at night? And that's where we started in 2009.
Thanks, Rob. Thanks for really setting the stage for us. I think it's challenging to imagine students in these conditions, and I think just listening, I think we can feel that sense of anger and how did this happen and why is this the case? So congratulations to you and your community and the accomplishment that you were able to correct this, really to bring people together around this issue and secure funds for improvements. We know that this is one of the biggest community organizing wins, not just in Baltimore, but in the country. Can you talk about some of your key takeaways, things that other communities can apply to their work that may be at a very different scale?
Sure. I think the first is that policy does not win alone. And what I mean by that is there's many experts on this call, particularly in public health, and you know the policy inside and out. Just like the ACLU of Maryland, we have a remarkable chapter of the ACLU in Baltimore, the ACLU Education Reform Project. They've had a history since 1992 developing policies to address educational disparities. So we had the policy. The ACLU did some remarkable research and developed a plan, a financing plan to address the $2.4 billion need. But what we learned is to act on policy change, you start with people. And what I mean by that is back in 2009, BUILD started our work. And just keep in mind, there's a very different context when we talk about BUILD in Baltimore. BUILD has a 30-year history of organizing in Baltimore that grew directly out of the civil rights movement. So as I talk and share this story, the context is that we have incredibly deep relationships in neighborhoods and throughout the city. But even then, we started with people by our clergy leaders visiting schools. We just didn't hear about the problem or read a report. The clergy visited the schools and they saw the conditions firsthand, met with parents one-on-one, engaged them, heard their stories. And one thing to think about is listening requires a response. And so many of us, when we hear the conditions, we want to fix them, right? I think, can anyone put themselves in those shoes? I know I've been there. But instead of fixing it, one, we didn't have the power to fix it, but instead of just trying to fix it and put a Band-Aid on it, by having a church do a fundraiser and do something for a boiler, the clergy then asked parents, what would they do? How does it make them feel that their kids are going to school in deplorable conditions? And then we challenged them and said, would they launch a basically facilities audit in the 10 schools that BUILD had a partnership with, or has a partnership with, since 1995. And I remember these conversations. I was in many of them, and parents looked up and said, we could do that? We're like, yes, we'll do it with you. So parents, teachers, principals carrying clipboards went and inventoried their own school, and parents began to identify the conditions. And part of making change is that people have to see it. And I don't know about the cities you all are in, but for a long time in Baltimore, how can I say this, that the unacceptable became acceptable. So we met with an amazing teacher at Fort Worthington Elementary School, and we engaged her and said, what about the conditions in the school? And she said, well, you know, it's not bad. I do the best I can, because that's the only thing she had the power to do, right? She was doing the best she could to reach the 28 kids, and beyond her classroom, she couldn't do much more. This young woman's name is a phenomenal teacher, Shannon Coleman Siciliano, and when she went on the tour with the clergy and parents, they showed her the basement classrooms that literally the water was shooting out of tile. And I don't want to speak for Shannon, I know her very well, but she looked down, and I think the best way to describe it is she was ashamed. She realized that she had begun to accept the unacceptable, and it radicalized her to do more. And fast forward 3 years later, Shannon Coleman Siciliano was the first co-chair of the Baltimore Education Coalition that has helped us preserve over $100 million in state cuts for schools. So we engaged people and we got them into action right away, inventorying their own schools. For many parents, and this I think would relate to many of the people you are trying to engage, they felt powerless. You know, Shannon felt powerless. But what we did together was say, we can use our power. So long story short, that led to 300 organized parents that we organized to confront our school CEO, Dr. Andres Alonso, who had just arrived back then, to repair buildings. And we called on him in front of 300 parents to make $2.8 million, not billion, but $1 million in improvements. But we knew it was not enough. And to Dr. Alonso's credit, he had an army of contractors within 2 weeks fixing up our schools to do that $2.8 million in repairs. But it wasn't enough. It was a Band-Aid, and we knew it. So our question was, do we have a power to leverage $2.4 billion to address this need? Our answer, as we reflected, is we couldn't do that alone. We couldn't do it with 10 schools and 40 congregations. Every school had needs, and we needed more power. We needed more people. So BUILD co-founded the Baltimore Education Coalition with the ACLU of Maryland and with our after-school initiative, Child First. And that now comprises 26 organizations so that we all could organize more people together. So my point here is policy matters, and working to educate lawmakers. And we would not have won this victory without the right policy, but we wouldn't have won this victory without starting with people first, because we wouldn't have the power to do it. So we learned again that organizing first to create change is about building relationships, and that's the most important to creating change. Building relationships now is the most talked about and the least used. I was in a session several months ago where people were quoting Harvard around building relationships. And you know, when that happens, it creates a buzz and people start talking about it. But building relationships nowadays is the most talked about and the least used strategy when it comes to creating change. And let me say it this way, I see it every day, and maybe some folks here can relate. Good people, well-intentioned, trying to make change, but not getting anything done. Or it's limited and they're not satisfied with it. So I was in a school several months ago, and this is a true story. I was there to try to meet with the principal, understand their interests. 26% of the children in the school have asthma. It's the blighted neighborhood around it, health conditions with kids, low attendance directly related to asthma. So there I am at Dr. Bernard Harris Senior Elementary School in East Baltimore, actually right where The Wire was filmed. And this younger person comes in, kind of bust through the door a little bit, and literally it was a public health person that was pushing a cart of asthma literature. You know those teacher carts that are all loaded up and they're pushing it in? She's pushing it in, and she's real excited, really good person, and she's asking for a meeting with the principal because the asthma rates in the school. And as soon as that happened, I saw it. As soon as she walked in, people in the foyer began to move away and turn to other business and go to the kids. And I could just see this public health person just get dejected. And so I went up and I asked her, I said, what are you trying to do? And as soon as I engaged her, she gave me the sales pitch on asthma and pushed a flyer in my hand. And I said, Miss, you and I don't know each other, but can I give you some advice? She said, well, what's that? I said, if you just take a moment to get to know people here at the school, and if you look around the environment, what do you see? I said, if you just turn the corner around this hallway, you're going to walk into the nurse's health suite, and honestly, right now there's 6 children lined up with either nosebleeds or asthma, illness that are triggered by asthma. Instead of trying to sell reducing asthma, why don't you just sit down with the nurse and meet the parents and hear from them what asthma, the impact of asthma in their life. And she looked up, and it was one of those moments where you can get some clarity. So I don't know what she did after that, but that's where you start. So if you lead with policy, many times you lose because you're missing the very people who are impacted. You got to get out and meet people around their interests.
Thanks, Rob. That's really, I just think, such an important message to really be focused again on the people. I've been butterfingers with the slides here, but I just put up a slide that sort of reiterates some of the key points that you just made about really meeting people where they are, understanding who they are, what their story is, why it's important to them, and making sure you engage people around their interests. And the stories that you have, I think, are just so compelling. So thank you for sharing those. So we've talked about policy does not win alone, and I know we have 2 other key things that are key lessons. So let's move on to the next.
Sure, that's a good summary. The second point that I think really stands out for other campaigns is to understand the local context and people. What do I mean by that? Look, the communities that we all are working in, that we believe in and care about, they're already organized. The question for us is, how can we help people reorganize their community around a focus, like we did with the BEC, a single focus: build schools, build Baltimore. We united the civic community, parents, schools, principals, philanthropy, and corporate sector and elected officials around one thing. In order to do that, you have to understand what is. So the community is already organized, and the challenge then becomes is understanding how it is organized in different groups, different constituencies. Identify specifically the leaders that already exist in community. The schools are organized a certain way, the congregations are organized a certain way. So we started with the community. We started with who is directly impacted by the policy that we wanted to change, right? We went school by school. We met with people, as we said, and we began to understand who were the leaders in schools, congregations who were affected by school conditions. And we used what's called a power analysis, at least in IEF terms as a tool. Basically, as you see on the PowerPoint slide to the right, this is not a technical tool. Someone asked me, well, what's the power analysis you used in this campaign? I said I did it on a yellow pad, and that's what the picture is here. A power analysis simply is how are communities organized constituencies that can help make an impact on this, to make this change. So if you look, I don't know if you can read the writing, but long story short, the yellow pad says BEC underneath its congregations and parents. We have looked at what's the interest of the mayor, what's the interest of the school CEO, what's the leverage we could have with the governor and eventually the Speaker of the House. What's the interest of the Baltimore Sun as an institution in this campaign? And what's the corporate community? And so Legg Mason is one of our top financial firms in the country, and located down at the Inner Harbor. And Mark Fetting was the former CEO, and we met with Mr. Fetting, and we understood who he was, that his wife is a teacher in actually one of the local schools. And we engaged him on this campaign around his interest, because his interest around education was for developing a workforce. At the same time, we met with the president of Johns Hopkins University and began to understand his interest in preparing students for his university. And he wasn't satisfied with the number of graduates from Baltimore of Johns Hopkins University. And at the same time, we understood his interest, that he knew, because Hopkins is also affiliated with the Johns Hopkins Medical Institution, that Hopkins could no longer afford to just be focused on themselves. They had to be focused on rebuilding the neighborhoods surrounding their campus and surrounding their hospital. So we wouldn't have done that. We wouldn't have gotten those meetings without a power analysis. It's a roadmap to the change that you want to create. Secondly, when it comes to a power analysis, a lot of people in community organizing and other arenas talk about community mapping, right? So a community mapping is basically what I just said with the constituencies, the groups. What's different, though, is we need to understand not only how the community's mapped, but specific leaders inside those different constituencies, and as importantly, their relationship with each other. So when it comes to our analysis of the governor, we understood the relationship with the governor with the chief of staff, Matt Gallagher, and the trust between those two from way back into the days that they were both serving in Baltimore City's government. So we knew that in order to engage the governor, we needed to engage Mr. Gallagher because of that relationship. So we eventually met with the governor, but we started with the chief of staff. So we can talk more about that later in this call if people are interested. And lastly, when it comes to understanding the local context and people, when I say leader, let me define it. The basic definition of a leader is someone with a following. It's not a spokesperson. It's not a mouthpiece. It's not the person that goes to every meeting in the community. I think, can you imagine the people I'm talking about? The leader typically in communities are the folks that don't say a lot, but if you're really observant in meetings or in the neighborhood or on the street, when they say something, people listen. People follow them. So we have principals that are those type of leaders. We have teachers. We organize a lot in schools, and I don't believe we can change schools by organizing parents. I believe that we can change schools by organizing parents and teachers and principals, because think about who parents follow. Think about your own children. I know I've got 2 kids, and if my children's teacher says I need to do something, I do it because I want what's best for my kids, and I know that I need to support the teacher. So if you can organize those few teachers at every school that parents follow and trust and respect, then you can begin to build a base out of those leaders. Now, many times in communities, around the country, there's limited leaders like that. There's lots of activists and few leaders. Our role in organizing is to begin to identify those informal leaders, and if they're not there, then help them develop themselves. So I'm the lead organizer in Cleveland. We met a parent, Robin Johnson, last year. When we met with her one-on-one, we walked into a public housing project. She has several children, and when we walked in, you know what she was doing? She was reading the paper. She had the New York Times. She had the Cleveland Plain Dealer. And we just asked her, from all the reading you do in the paper, what do you want to do? And she said, I want to do what's best for my kids. And I'm trying to understand the politics in our city to do it. It was like a gold mine, right? It was a gift. She was incredibly interested, passionate, wanted to make change. And then as we talked to her, we said, well, if you called a meeting, how many people would come? And she said, well, I don't really know anybody. And we said, are you willing to get to know people? She said, yes. And so we organized a door-to-door campaign with Miss Johnson to meet her neighbors around what's best for the Carl Lewis Stokes School in Cleveland. From that work, Miss Johnson and other parent leaders, teachers, janitors, nurses, built a team of 35 parents at the school. So one way to think about leadership is leaders are made, they're not born. And they're not what the establishment or the mainstream society say leaders are. The establishment says that you have to have nice hair, you have to be attractive, you got to speak the best. But the parents and teachers that led the reform effort in Baltimore were ordinary people doing extraordinary things, and what made them different wasn't how they looked or how they talked or if they had a PhD. What made them different is that they had deep relationships with people in their schools so that we could organize together, build a strong base, organize across sectors because we knew that we couldn't do it just with the schools. We followed our power analysis and met with the philanthropic community led by Tom Wilcox at the Baltimore Community Foundation. And actually, it was Mr. Wilcox who got us the meeting with Mr. Fetting. And so we organized first in our community because we understood the local context and people. And then we engaged the philanthropic sector, the corporate sector, and their elected officials. And it culminated in one of the slides you saw. It turned out 3,000 people on the front steps of Annapolis, our state capital. And just to close this point, if you were there in front of the 3,000 people, you know who you would have seen? You would have seen student after student saying how important it was for them to have a new school. You would see a parent testifying, several parents testifying, a teacher, a principal. But you know who also you saw? You know who helped champion the $1 billion in front of the state capitol? It was Mark Fetting, the CEO of Legg Mason, who joined us. It was Tom Wilcox. And then because of all of our work, we organized our city delegation to be united around one thing. And then we went to the Speaker of the House through our city delegation chair, Delegate Kurt Anderson, and then Delegate Maggie McIntosh. And through all the relationships that BEC had, we focused it on engaging the speaker. And you saw the slide with the mayor talking about that we're going to get this done. The Speaker of the House came and he championed the bill. And without his support, the governor's support, we wouldn't have won. The last thing about the speaker is when we met with him, we know him well, we know his background, but it was a shock to Baltimore City parents when we met with the Speaker of the House, Mike Bush, and as we began to present this, he looked at the parents and said, "Can I just interrupt?" We said, "Yes." He said, "I don't know if you know this, but I went to school at Leithwalk in Baltimore City, and the conditions of Baltimore's schools are unconscionable to me." We wouldn't have known that unless we engaged him and listened. So we started with the local context, and then we built out from there.
Great, Rob. Thank you so much. I just want to be conscious of time here and make sure we leave some time for questions. So if you can maybe wrap up your next couple points in about 5 to 7 minutes.
Sure.
And then we'll make sure we get some time for people's questions at the end.
That's great. I'll try to make it short. The third point we talked about was action is like oxygen for organizations, for these organizing efforts. We've got to create actions that galvanize people. And let me just share what I mean. I was in a meeting with 25 parents and teachers kind of about a quarter way through this campaign. We were fighting to get a bottle tax passed in our city because that was the first installment of city money. It was a nickel per every bottle. A teacher shared with the group that just the day before it was 102 degrees in her classroom and her children wanted to learn. She wanted to teach, but by the end of the day they just got worn out. They couldn't do it. And I could just feel the sense of the room shifting. People were angry, ashamed. Instead of just talking about it, I said, what do you want to do? And they said, we don't know. We want to do something. I don't know if you can relate to that. I said, act. How about this? Call every one of the city council members and invite them to sit in that classroom with you during the school day so they feel the conditions of what's taking place. And Councilman Ed Reisinger, who's the vice president of the council, as you see on the slide, he was the only one that showed up. And the parents and teachers called on him to champion this work. And you could see Councilman Reisinger, he was sweating in the class. And he committed to doing it. And as he committed to doing it, a parent said, well, where's everybody else? And on the picture here, you see that we put up photographs of the council people who didn't show. And I said, one of our leaders said, well, let's call them. So during this, what we call an action, parents began to call every council member and ask, where are you? So by the time that Councilman Reisinger got back to the city council meeting that day, there was a buzz. And he expressed an anger to our city council that grew out of him experiencing the conditions that kids go through. So that's just one example. The last example is we have to help people imagine what can be. In other words, when we started talking about brand new schools, many folks couldn't really relate to that. So we took buses to the best schools in the city. Excuse me, not in the city, in the state, to Montgomery County and some more affluent areas so that they could begin to imagine what this could do with their kids. So create action that engages people where they can live it and feel it as you move the policy through.
I think that's a great point, Rob. And I think it's important for people to remember that, you invited all the city council members, only one showed up. That one became a champion. So it's okay if you don't have a 100% success rate with what you're doing. Start somewhere and build from the response that you get.
And don't accept no's. Figure out a way to act on the no's. So we took out our cell phones and called them right there. That's not the answer to everything. In other words, be persistent. Don't stop.
Yep. All right. So can you share with us now the rest of the story?
Sure. The rest of the story is we culminated our work with 3,000 people on the front steps. Long story short, we went through every hearing in our state capitol with parents and teachers and our corporate and philanthropic allies with us, and we won because we united the city around one thing. The rest of the story is it's still about people. So the slide you see here is of Jackie Wardell. Jackie was a parent that we met on the front stoops of one of our schools. She built a team with other people of about 30 people at one school that then turned out 163 people at our actions. One of our organizers, Yasmin Mumby, met with her afterwards and looked at Miss Wardell and said, "Miss Wardell, what does this mean to you that we won?" And she looked up on her front stoops and said, "I never dreamed that I would ever do something this big for my kids. I'm ready for the next step." And so now Ms. Wardell is leading our engagement campaign now with other parents and teachers and organizers to now that we have the money, we got to design and implement the schools. So it's still about the people.
Thank you so much, Rob. This is just, I think, such an inspiring story for people to hear about your successes and those key lessons that I think really apply no matter what scale you're working at with policy change. So we have just a few moments here for questions, and we have one here about you talked about bringing groups together and getting people to really focus on one thing, and that being Baltimore schools and getting funding for rebuilding Baltimore schools. The question is, how did you get the groups to work together without fear of losing control? People, they get into these turf battles sometimes. Did you have that problem at all, where people wanted their piece of the pie or were worried about losing their control of their specific area of interest?
Sure, there was tension around that. I would just make 2 points. Is one, power to make change flows from relationships. And so this is a very different context than what other people might be going through. But we had built strong relationships with leaders of different organizations inside the coalition so that we could have a conversation not about turf, but about how can we maximize our power to create change. Because of those relationships, we didn't have the splitting of coalitions and that other coalitions might experience, or the turf battles, because we understand power, and power is not something that you hold, and that if I share some, you lose some. If you have the relationships where it's reciprocal, if you share your power with others, you're going to have more and they're going to have more. So that's the first thing. The second thing is we looked and challenged each other to say, look, we're all doing good work. There's nothing to say that we're not. But given this particular moment in our history of our city, given the politics and given that we have a policy solution, this is our moment. Do we want to seize it or not? So if you're in relationship, you can agitate one another, where, not irritate, agitate, stir up, challenge each other and say, are we going to do this? And I think many times we don't take the risk to really call a question and engage people. We try to sell people or manipulate them in a way that they're going to do what we want them to do. So we got to be willing to take that risk, but it doesn't work unless you have a solid grounding of relationships.
I think that's a great point. I think we hear over and over again from communities that have had success that the relationship building, that the building the trust with the people you're working with is really a huge component to getting things done. And so while that takes time and that can feel like you're stifling action because you're spending time building those relationships, that really in the end is what's going to move you forward. So I think that's a really important thing to keep in mind.
I would say it this way real quick, is the issue is relationships, because absent of that, you're not going to be able to be effective on the policies that you want.
That's a great point. I do want to quickly share, because Rev, you talked about a really huge victory, and some people may be thinking, wow, we're not really trying to get $1 billion. We're doing some smaller things. So one of our participants, Laura from Arizona, has shared that they've also really relied on that relationship building process and in identifying community leaders to come out and see. They wanted to do some neighborhood cleanup, and that they've gotten community leaders to come out and see the issues firsthand, that they've gotten more people partnering and volunteering to do cleanup, and that those residents now in those neighborhoods that have been cleaned are taking that on themselves and are continuing the process. So a much smaller scale effort, but equally important to the people in those communities, because that's what they identified as a significant need. And they were able to pool together volunteers and partners to make that happen. And it sounds like it was really, again, through building those relationships, helping people understand and see what the problems were and want to step in and make a difference. So this can really happen on very different scales. Thinking about what, again, it's going to the people, understanding what they want to change, what they need to change, and then helping them to make that happen.
Sure.
Rob, we want to thank you so much for your time, for your very, again, inspiring presentation and sharing your story with us. We are going to move into wrapping up now, but please feel free to message us any other additional questions that you might have. We'll try to share those with Rob. And thank you for, we've had some really great participation from Laura and others chiming in with some of their successes. So thank you very much for sharing those with us, and we try to share those out when we can.
Great, and I hope that this gave folks just some ways to think about all the work that they're doing, no matter what scale it's at. And if people are interested, I know we didn't get to many questions, and I apologize for that, is we could set up a time specifically around those questions if that's helpful. So it's been a real pleasure.
Thank you so much, Rob.
All right, so thanks to the support of the Robert Wood Johnson Foundation, we have 3 community coaches in the County Health Rankings and Roadmaps program. And our assistance is available at no cost to you, so please don't hesitate to contact us if you need assistance with the tool, have a question, or about a next step in your process. We are here to help. You can register for upcoming webinars and find recordings at countyhealthrankings.org/webinars. We're going to chat that link out to you so you can find it. And as always, we invite you to stay connected with us. You can follow us on our County by County blog on countyhealthrankings.org. You can follow us on Twitter, like us on Facebook, and subscribe to our e-newsletter. Lots of great information on all of those platforms, so please stay in touch with us and stay connected.
And this is a great quote that in one of our first conversations, planning conversations, Rob shared with us, and we wanted to share with you. Power concedes nothing without a demand. It never did, and it never will. And I think this really speaks to organizing the people and working with the people in your communities to make changes.
So thanks to Rob, and thanks to all of you for your for listening in and for your participation. And stay tuned.
Thanks much.
Thank you.